Nyandagire Health Center 3 serves a population of over 80,000 people, many of whom are women of reproductive age and children. For the past 10 years before 2012, Nyandagire Health Center did not have a midwife. Mothers moved longer distances in search for the nearest maternal health services.
Obusoka twazaliranga wane Kiboga kubanga wano emulaji tewali wabazalisa. Ndina abaana bange batano, abasatu nabazalira Kiboga, owokuna wenyonsa namuzalira emulaji nga bamaze kudusindikira abazalisa.
And because so many mothers were going to the TBS, some of them would have medical complications that like overbleeding after labor. Some of them lost their babies, some of them even lost their lives.
Abachara baffe basanga obuzibu bunene nnyo okuzaala nga bazalira mu kyalo nga bazalira ku bitooke abalanga bagenako kalimba mulirwa naye batalina bukugufu mu kuzaala kw'abaana.
In a bid to seek long-term sustainability solutions aimed at improving health services and governance at the local level, the community supported by World Vision in Kiboga district employed a local-level advocacy approach known as Citizens' Voice and Action to address their challenges. Through the approach, the community identified and prioritized challenges needed to be addressed using affordable and sustainable solutions. This was done by encouraging increased dialogue and accountability between citizens, service providers, and the government. Using the approach, the community undertook a series of actions to ensure recruitment of a midwife despite inadequate government funding at the time.
CVA is about empowering community to demand and access quality service,
in which we are empowered to identify the issues affecting quality service delivery. In this, we came up with action for issues identified in the gathering. Notable action was to forward some of the problems chosen to be worked upon by the authorities.
Oluvanyuma bamala okubaga ekiwandiiko kyabwe ne bakireeta kugombola mu kanso ey'eggombola yennyini eya Sub County Emulaji. Tumala okituulamu ne tulaba ebyali bisobokamu ebitonotono ne tubikolako ebyatulemesa ne tubuweereza ku district.
Nayo n'ekiraba nga kyamaanyi era naffe ne tuyisa resolutions ez'enjawulo okulaba nga tubeera n'abasawo naye ng'okusingira ddala abazaalisa era kye twakola twawandiika mu Ministry ya Health ne Ministry ya Public Service.
An advocacy coalition in Chankwanzi district created platforms for dialogue with the district council. Using evidences generated from the community gatherings, they developed a joint statement which was presented to the district council. Through this dialogue, a resolution to immediately recruit medical workers, including midwives, for Nyandagire Health Center was made. However, with insufficient fundings at the district, these matters were presented to higher levels of authority at the national level.
Collectively, as various implementing partners in the district, we did write reports. A number of reports tend to come up, which were distributed, disseminated to the various stakeholders at sub-county level, at the district level, and even at the national level.
The advocacy agenda at the national level at the time provided opportunities for platforms to be created where the health workers' crisis would be addressed. The Civil Society Coalition for Reproductive, Maternal, Newborn and Child Health used evidences from Nyandagire Health Center 3 to advocate for increased allocation of funds towards the national health sector budget of the year 2012-2013. This was done by working with members of parliament who played a major role in ensuring that the national health sector budget is not approved until more money is allocated for this cause. Members of parliament were met at budget conferences and during national dialogues where testimonies were shared, and also bringing the media on board helped to keep the debate in the media arena.
So we had to mobilize ourselves as members of parliament, particularly women members of parliament, to ensure that we don't pass the budget. We lobbied our counterparts, the male members of parliament, and even more, people from civil society to join us to ensure that we have more funding for the recruitment of more health workers, which we did successfully.
What started as a community concern in Mulaji sub-county contributed to an increment of 49 billion Uganda shillings, approximately 19,600,000 US dollars, towards the 2012-2013 National Health Sector budget, specifically for recruitment and retention of health workers.
There is a reduction in the workload. And secondly, we are beginning to see an increase in attendance at the health facilities.
Currently, we get between 80 to 100 mothers per month, and the number of deliveries has also increased. It now ranges between 15 to 20 per month.
Empeereza ya wano ku ddwaliro nnungi kubanga bwe tutuukawo abasawo tubasangawo era eddagala balituwa.
Communities have been empowered to demand for services, and not only in health but also in other sectors, especially education.
Citizens' Voice and Action is a local-level advocacy methodology that strengthens constructive dialogue between citizens and government in order to improve the delivery of social services like health and education. By using Citizens' Voice and Action approach, World Vision has the unique ability to amplify the voices of citizens and influence decision makers for dramatic improvement of child well-being. In Uganda, for example, 33 communities have demonstrated successes in claiming for better services spread over 25 districts.
World vision in the eyes of a child. World vision, a helping hand, a friendly smile. World vision, reaching out to those in need. World vision of God's love and charity. A world vision of God's love and charity.